2 weeks ago, results from a benchmark poll showed that Manitobans were most concerned with affordability and with healthcare. So that survey found that 70% of respondents cited wait times in emergency rooms as their most pressing concern. Meantime, on the primary care front, Manitoba only received 2 out of 150 family doctors they were promised by a recruitment firm 2 years ago. We reported on that at CBC yesterday. Last year, in addition, Manitoba saw a net increase of 133 physicians. That is the largest on record. But Doctors Manitoba says the province still ranks second last among physicians per capita in Canada, with 219 physicians per 100,000 residents being that number. Now, Dr. Nichelle Desolé is president of Doctors Manitoba. She spoke with CBC's Marjorie Dowhouse on Up to Speed yesterday. She says the province needs to use retention as a recruitment tool.
Canada, from coast to coast to coast, is short on doctors. So we have a high level of competition that we're up against. We need to make sure that we're staying competitive, because if we're recruiting physicians that are fresh out of school who don't necessarily have ties to a particular community, the world is their oyster. And if we're talking about recruitment from outside of Canada, we got to make sure that different jurisdictions, we're not being out-competed by different jurisdictions.
Now, we're going to have a conversation next with another doctor who traveled to the Netherlands in February to understand how that country, a population of 18 million, managed to find, as I said at the top of the hour here, a doctor for 94% of their population. And could we do that here? Dr. Tara Kiran is a family doc and researcher for St. Michael's Hospital and the University of Toronto. She's the host of a podcast called Primary Focus. Good morning.
Good morning.
So how could we do that here? How did they make that happen?
So they actually have a family doctor, primary care doctor for 99% of their population. So it's even more stunning. And, it's a lot of things that go behind that. But, one overarching piece is true that they actually do have more doctors per capita. So 1.6 times the number of doctors per population. But they've also figured out how their doctors can care for more patients using effective teams. And in particular, they have team members, nurses, and practice assistants who support the doctor so that the doctor really can work at the top of their scope and look after the most complex patients. And also, actually, the other piece that's really important is that it's not just that people have a doctor, but the doctor's offices are designed to provide really timely care.
What do you mean by that? How are they designed differently to provide timely care? Yeah.
So interestingly, in the Netherlands, the doctors actually, the general practitioners, they call them, or GPs, they are the first line of contact for everything, including most things that are urgent or emergent, except for anything life-threatening. So if you have something life-threatening, you can call an ambulance, you go to the emerge. But actually, if you think you hurt your hip or, broke your arm or you're having really bad stomach pain, sometimes in Canada, we would go to the emerge for that, even if you have a family doctor, because some people might not be able to get in there to their family doctor or think their family doctor can't manage it. But actually there you have to see the family doctor first before you can go to the emergency department. So the family doctor would refer you to the emergency department. So they've really designed their office to be able to take timely calls from patients. And the secret sauce, I think, is an individual they've trained called a practice assistant, which is kind of a cross between a medical receptionist and a nurse. And this person has been trained particularly on primary care triage algorithms. So, they know what to do when someone calls in with a fever or abdominal pain or all sorts of other things. And is it something that, can just be managed on the phone, or is it something that actually needs the doctor's attention today, or can it wait till next week? So they really help to support the patients at the time that they need it and navigate them through to the place where it's where they need to be seen, whether that's in person in the clinic, just managing over the phone, or actually the doctor doing a home visit, which is another cool feature of their system.
So what's interesting is you said a couple of things that if I were to interview the health minister or any politician, they would say, well, we're doing that here, team-based models, and we're trying to get people out of ERs, and they would cite in Manitoba urgent care centers and different models to try to get people in different places and out of ER, which all those things are happening. So what makes it more effective? Like, what's the difference between a team model that you saw there versus here? You mentioned some new positions, or do you think it's the geography or is it the cultural understanding of how their system works by the people?
Yeah, that's such a great question, and I think you've actually, hit on a lot of important points at one time. So I would say yes, there are a lot of good things happening in Canada now. People have recognized, governments have recognized, the government of Manitoba has recognized the importance of primary care and opened up things like urgent care centers and trying to expand teams. But I would say, at this point, it's the minority of patients that are actually with a family doctor who's working in a team. So we haven't actually scaled this up to be standard across our country. So that's a really big difference. In the Netherlands, what I just described in terms of the practice setup is a standard way of practicing and operating in every practice. I do think that the after hour centers are a wonderful thing. Really interesting in the Netherlands, they also have general practitioners working together in after hour centers that are collective and serve a region, which I think is probably quite similar to what is being set up in Winnipeg. So everything in the right direction, but it's just scaled up to cover the entire country. And I think another piece, though, is yes, the teams have to be set up in a way that are most effective. And I think there they have really focused on trying to ensure that the teams are supporting doctors to see as many patients as possible and ensuring timely care. And, I work in a team model myself in Ontario, and I love it. It's a wonderful place to work. And I think, though, that there are more things that we can do in a team to actually expand our capacity to see more people. The way teams have often been set up is to provide more care to the same people versus provide more people with care, if that makes sense.
Um, what did you learn about? I want to look at just another aspect of things. What did you learn about home care while you were there?
Oh no, I think.
I've still got you here, so I'm not sure if you can hear me. Are we having a Zoom problem, perhaps? We're having
Okay,
a.
I just heard you again.
Okay,
Yes.
super. That's great. I'm glad you're still with us. I just wanted to switch gears for a moment and ask about another aspect of the healthcare system. What did you learn about home care while you were there?
So one of the things that's wonderful in the Netherlands is that they actually do home visiting. So, if every doctor, I should say, between 1 to 2 p.m. in their clinic, so about an hour a day in their clinic, except for they keep one doctor who's working in the clinic, but everyone else has 1 hour blocked off to do home visiting. Part of this is geography, as you mentioned, because patients are supposed to live within 15-minute driving distance of their doctor. So it's part of the tradition of general practice to do visiting in the home and actually support patients, for example, with end-of-life care. What I love too is when they have their urgent care centers, their after hours centers, they had a doctor who was supporting practice assistants with, people calling in on the phone, and they were trying to ensure people were getting the right care they needed. Another doctor seeing patients in person in the clinic, but another doctor who would actually go out and visit people in their home if needed. There was actually a professional car and driver that would take them there, which is amazing.
How would that change things here in Canada? Like if you this is a hard
Yeah.
question because, but I
No,
wonder whether or not that's something you as a doctor would say, yes, like let's do that right now. That would be amazing.
I think it would, be so amazing for patients. We know, I'm sure elderly people who have a lot of medical conditions or other conditions, and they can't leave the home and really easily. And let's say something happens to them, they need to get care. And so then maybe they'll call the ambulance and they'll get taken on a stretcher and taken to the emerge, and they'll sit there waiting to be assessed and being assessed and have all the things done. And that might take several hours, and maybe they're lying on the stretcher that time, and maybe they even develop a bed sore. So it's really not a very humane way for us to be able to provide services to some of our most vulnerable patients. And, I think this is an incredibly patient-centered way. If you are able to, as a GP, go to a patient's home. I think what we have to do, though, is restructure our system so, that the regional after-hour center is actually really covering a region that you can access with the car and driver. And they're actually, the doctors are running the after hour centers, and they came up with this thing that they have a car and driver, and they've got a laptop that they bring with them. And so the doctor doesn't have to actually do the driving, and the doctor can like look at the notes in the car while they're being driven. And then when they come back, They can write up their notes again, and they've got someone there with them. They're not doing the home visit alone. So it's a really wonderful way in which they are delivering service both during the day and after hours. And I think there's elements that we can bring to Canada. Of course, geography is a challenge,
Hmm.
but actually a lot of what they do is virtual care too, in a way where, timely calls that actually help to support them. It's virtual care integrated with in-person care, integrated with your actual records, which is different than often how virtual care is delivered in Canada these days.
Lots to learn here. Lots to learn here. Thank you very much for starting the conversation and telling us at least about part of what you learned on your trip. Appreciate having you with us.
Thank you. And if your listeners are interested, they can go to our podcast because I do a real deep dive in there and take them with us, primary focus.
Appreciate it.
Thank
Dr.
you.
Tara Kiran, who's a family doctor and researcher at the St. Michael's Hospital at the University of Toronto. As mentioned, she's also the host of the Primary Focus podcast.